think the thing that I always say, and I've always said it from my age, like patience creates understanding, which creates good relationships.
Because I think it's also important as professionals and as people that have experienced the care system, people that are working consulting the care system, we continuously focus on like the risk averse side of things when it comes to children and young people, forgetting that actually there's some level of normality in those stages as well. Like your brain is wired to want to seek risk-taking behaviors, seeking thrill-seeking, you know, activities and experiences is very normal for the average adolescent. So it's kind of holding a mirror up to actually if you know that you have concerns for what this young person is going through, rather than jumping straight to the correction part, one, be a part of the solution if possible, or try and outsource and find out how that might be something people can come together to present as actually an alternative that's safer, that's healthier, that's more encouraging of their care needs being met, their emotional health needs being met, and also actually just trying to understand the person. So unpicking what is it that they are seeking and what are they finding when they go to this behavior, when they go to this person, when they do this thing. Because actually, if there can be solutions paired with the one that's not safe and ideal versus the one that we would all like the young person to do, if it's presented in a way that the young person can understand, but oftentimes, I find if you prioritize the relation and the connection part, you would find that the practical side of safeguarding is a lot easier and you would do it collaboratively as opposed to an adult that is controlling the narrative and doing what they think is best because of risk averse practice.
I think the thing that I always say, and I've always said it from my age, like patience creates understanding, which creates good relationships. If you don't have any of these, you're not going to have a good relationship. And I think the foundation of anything, it doesn't matter if you're in residential care or you're cared by caregivers or
Mm.
your parents. Without a foundation, you can't build that trust where your children and young people would speak to you about anything or most things anyway.